As introduced, I'm from the charity Yes to Life. I'm not here to talk about Yes to Life, but I'll just very briefly tell you what we do. We're directly supporting people with cancer in accessing integrative medicine. And we're running an educational program to make people aware of the fact that there are some choices in cancer care. So those are the two things we do largely. So today, I've been asked to speak about integrative cancer care in Britain, in the UK. Integrative cancer care is a wide-ranging beast. You know, it can go anything from one end of the spectrum. We help people who are maybe just dabbling their toe in complementary medicine for the first time in their lives, alongside just following the doctor's orders. At the other end of the spectrum, you have the warriors who are out there, right? No, I'm not doing any of that. That's not my style. And they're finding their own way through completely. Most people are in the middle there somewhere. I'm going to be talking about kind of the middle here. I'm going to be talking about integrative medicine in the way that it could be, which is medicine that actually looks at what works. It looks at, it doesn't matter where it comes from, the medicine, is this going to be helpful? This is a bit of where we come from here. This is the 20th century, okay? The big punch-up, basically all the quacks on one side and the orthodox on the other side with the evidence and everything. This battle has been slugged out through the 20th century. It's just forced people into, well, which camp are you in? You're going to go with the alternative, you're going to go with the orthodox. And entirely unhelpful. People who've got cancer, they suddenly get landed in the middle of this battleground. Wait a minute, I just want to get well here. And really, they don't want to know about the battle at all. It's just another problem thrown at them by the whole world of medicine. So, and what's developed in parallel, these two completely different philosophies of medicine and ways of approaching well-being. So, the orthodox side, yeah, looks very much at the body as below the bits. Oh yeah, you've got a problem in your kidney there, you've got a little tumour there, we'll get that fixed, and then you'll be all right. Now, you know, you have to say there's been some great successes, some. And certainly with emergencies, this kind of approach, magic. You know, many of us will be enormously grateful for the emergency procedures that are available in this country on the NHS. Unfortunately, for most of the common cancers, it's not very successful. And the common cancers means the most people. So that's very sad. And if you've got secondary cancer in this country, well, you know, they're looking at you as somebody who's going to die, basically. Whatever they may or may not say to you, that's their view of you. And they're going to treat you accordingly, which means they're going to just sort of give you stuff which makes it not too bad on the way, they hope. The side effects are legendary for most of orthodox treatment, and many people give up a particular course of orthodox treatment because the side effects are so bad they think it's just not worth living if you have to go through that. So it's a big problem. And lastly, we have, this is the currency we're in amongst now, where basically orthodox cancer treatment, everybody's acknowledged it's going to a place that we can't go. We can't afford it, and it's too complex. You know, some years ago you had breast cancer. Now there's, I think, 80-something different kinds of breast cancer, and they're still looking for the magic bullet for each one of those, and that's just breast cancer. And each one of those needs millions and millions and millions of pounds thrown at it to find the magic bullet. Is it going to work? Well, you know, it's just not tenable. So that is a big problem that orthodox medicine is facing right now. So some greens, some reds. So on the other side, we have your holistic system. So this is looking at the body as a complete system that, as Fiona was describing so eloquently earlier, has got in a condition where cancer can happen. So most of the approaches are what you would call natural medicine, often described as, but complementary and alternative approaches, they tend to apply to all cancers because they're not really They're not treating the cancer directly. The cancer, as Fiona was saying, is like the end symptom. They're treating the root causes. A great point about them is that nearly all of them are non-toxic. They're kind of, they're what you'd recommend for a good lifestyle, but you just turn the volume up, basically. You got cancer? Well, you're going to need to do a lot more of what you thought was a good idea before you had cancer. A great number of these approaches, they do utilize the immune system, the body's own immune system. This is the most sophisticated thing that we know of for dealing with cancer, much more sophisticated than any kind of treatment we have. And as we all know, cancer is a very tricky beast, and it has this great way of changing its style in accordance to whatever you try and attack it with. So there's no better thing to actually meet it with than the immune system, which has got the same kind of craftiness built into it. There's a huge amount of science going into investigating nutrition, for example, and finding out the enormous complexities of a carrot, a piece of broccoli. Now, they know about this bit of the broccoli, that's good for that, and they've worked out that this bit is good for that, but they have got no idea what this complete thing, a piece of broccoli, is capable of and how it does it. The actual, the totality of a piece of broccoli is a mystery, but it's just the complexity of it is comparable to the complexity of cancer, though. Compared with orthodox medicine, pretty cheap and simple. It's not cheap. Anybody here who's done it knows it's not cheap because we have to pay for this stuff. But nonetheless, compared with orthodox medicine, it is. But it's not the best thing if you've got an emergency generally. You know, can be, but it's not really. So it's got its strengths and weaknesses. So a few more ticks on that side, I'd say. So what is integrative medicine? Well, I'd say working together for the best outcome. Okay, so it's a team effort where the interest, as I said earlier, is in what works. This is the most important thing for the person with cancer, and it's very importantly what works and not what's profitable. Unfortunately, cancer treatment is based on business. The prime motivating factor in cancer treatments is business, and business doesn't really have any interest in our wellness. It's interested in making profit. So this is very important, that's a totally different agenda to the agenda of people with cancer. So we're looking for a situation where both the patients and the doctors are working to the same agenda. They're interested in what's going to work, what's going to help this person, what's going to make them better. It's different things for different people. This is the thing about integrative medicine. It doesn't look at people on the evidence-based medicine principle, evidence-based marketing, as I often think of it. Which says, okay, well, 42% of people respond well to this treatment, so we'll give it to everybody. And, you know, the rest of them, well, they'll just suffer through the side effects. And even the positives are, well, they're a little bit questionable. Every case is looked at as unique. Every person is unique. They may have a cancer that you can give the same name to as somebody else, but their body is different. Their health history is different. Everything about them is unique. So to have a sort of prescribed remedy for them doesn't make any sense. I heard somebody describe the kind of evidence-based medicine approach as saying, right, okay, we're going to take all the people in Britain and we're going to work out what their average shoe size is, okay, 8.5, right? Everybody's going to get 8.5s. Right? Now, you know, some people are going to do quite well. You know, the 8.5s, the 8s are probably okay. Even the 7.5s, bit of cotton wool, you know, they're going to manage. But for a lot of people, just, you know, it's irrelevant to them. It just doesn't work. They will put them in the bin. So within integrative medicine, there is this huge range of possibilities. I think we were hearing earlier that really the amount of choice or possibilities that is offered to you within orthodox medicine is still stunningly narrow. This is its problem, really. They've either got something that they think will work for you, or they just haven't, you know. And there's really nowhere to go. And so the poor doctor's actually in the same position as the patients, are just like, well, we have to give up, pretty much, you know, given that set of circumstances. Possible objectives for treatment. Here's a few here. Killing and removing cancer cells. That's a pretty well-known objective. Controlling cancer for an extended period. That's another possible objective. Finding and removing as many root causes as possible. Fiona spoke about that. And restoring normal immune functionality. So these are all possible things that we could be looking at trying to do in our treatment. Killing or removing cancer cells. So in terms of UK conventional medicine, this is the number one thing. This is what they're trying to do, essentially. And, well, you know, if you go in there with a very early stage contained tumour, you know, this can work quite well sometimes. You can get away with it. You can have not been in such a poor condition beforehand that you won't actually survive just on that piece of surgery alone. But when actually having that as your main focus, some of the treatments are completely radical. They're much more than just surgery, and those often have a very high price to pay in terms of the amount of collateral damage to the body at the same time. There are some strategies for killing and removing cancer cells. The non-toxic ones are the ones that are preferred. There are some non-toxic strategies for doing exactly that. There's also a fantastic range of secondary strategies which will go at cancer cells from all sorts of different directions. One of the things I was saying earlier is the cancer is incredibly canny. You hit it one way and it goes another way. So basically, a good integrative strategy is one that thinks of as many of these ways that we know about as possible and has a go at them all. So you try and undermine cancer or block it or control it in every direction you can at once. So there's some great secondary strategies within integrative care. And since I've said there's often a high price to pay with conventional treatment, actually you can minimize that substantially by using integrative medicine to support the treatment, to actually make the treatment work better, to support the body in protecting its organs from damage, to make the immune system bounce back after it's been flattened by chemotherapy or radiotherapy. There's lots of strategies for actually making orthodox treatment much more bearable and more effective. So let's have a look at controlling cancer for extended periods. Conventional treatment has got some strategies now, particularly in the area of hormone control. Hormone-driven cancers, yeah, they're quite likely to try and control that and therefore extend your life. There are one or two other techniques, but it's not something that too much attention has been given to yet, but it's beginning to be. There's the glimmerings of an idea that people could actually live with cancer rather than it just killing them. So, but again, even with the hormone control, there's usually a high, quite a price to pay, and some people just can't bear being on hormone treatment. The picture of cancer that's always been touted around is that it's like a graph that sort of starts like this and just goes like that, and then you die. Yeah, it goes berserk. And your only chance of surviving cancer is you get in somewhere along the curve, not too far down, hopefully, and you go ka-chop like this, and you kill every single cancer cell dead, and then you might be all right. And if you fail, well, you've had it. So that's the picture that's been sold of cancer. It's not true. It's not what happens. It's quite obvious from studies into mammography that they've been treating lots of women with tumours that would have gone away on their own if they'd done nothing at all, because they found out that, comparing countries that have had mammography with the ones that haven't, this must be the case. So they're finding things that never needed treatment. So cancers, clearly, they go up, they go down, and it depends on what's happening in the body, whether the body's actually cancer-friendly or not. Let's have a look at the other side of the picture. So this is a real strength. There are an enormous number of strategies for keeping yourself going, even though, this is with people who wouldn't necessarily say they were cured of cancer at all. They might still have quite measurable disease, but nonetheless, it's not going off like this. It's actually staying steady, it's sort of fluctuating or whatever, and they're having a good life. They actually feel well, they're out there, they're doing things. And because cancer's a bit tricky, they may need to adjust their program and keep monitoring it all the time to see that it doesn't get out of control at any time, and they might have to change their strategy a little bit. But nonetheless, it's extraordinary what's possible with this kind of approach. Once again, most of these things are non-toxic. There's no negatives to them generally. Occasionally there's some mild side effect or something, but it's not common. And again, if you're going to go through one of these, let's say a hormone treatment, there's a lot of things that complementary and alternative medicine can do to add into the picture, which will actually make the whole thing more bearable. Yeah, the question was really to give a definition of what integrative means, fundamentally. So integrative, I was trying to say at the beginning, but maybe I didn't make it clear enough, is the bringing together of whatever works. So whether it comes, you can say because there's been a divide and we've had two camps, we've had complementary and alternative medicine, orthodox medicine, it means bringing these two together and using them both to actually make you well, and using the synergies of the two to make you well. But actually, in essence, once that you've forgotten about the battle, it actually just means, as you were saying, well, whatever works. Finding and removing root causes. So this is really not on the agenda for orthodox medicine. They don't think about this at all, really. They've got as far as smoking, and they've got just beginning to think about weight loss. These two things are like, they might be actually advising their cancer patients that maybe it's not a good idea to go on at 25 stone or to carry on smoking when they've got lung cancer. But, the most cutting edge people in oncology are starting to consider lifestyle. I'm talking about the UK here. In other countries, they're way further ahead than we are. But here, it's only just beginning. It's a thinking that what we do might have some effect on how well we are. On the other side, well, this is like fundamental. This is basic to integrative medicine. It's like, well, if you don't, it's a bit like, Fiona gave a great example with the fish bowl there. If you don't look at the environment, if you don't look at what you've been doing up to now and question it, well, okay, you've had a bit of surgery, you've taken away the tumour. Why on earth wouldn't you just grow another one? There's no reason to say you wouldn't, is there? Because you haven't changed anything. You're still fundamentally travelling in the same direction. So the same stresses, the same toxins, all the things that have led you to get where you are, the same bad food. It's a downside of our health service, unfortunately. That's my view of it. I'm not an anti-NHS person. I love the NHS as a concept. It's fantastic. But what it's meant up to now is, it's meant we've had a healthcare system that we pay for it, and then it tells us what we can have. Yeah? And that's led to this sort of cartel, which is basically business feeding into government and doctors to keep a nice little thing going between them, which has got nothing to do with what we think. Yeah? And so business, which is the one at the top of the triangle that I just pictured there, is the one that's actually calling the shots because they've got all the money. So lifestyle's not in business's interest, really. It's not. Restoring normal immune capabilities, well, again, in terms of UK conventional, not really. There's a little bit of this, okay? They do have some things which aim to boost your own immune system to deal with cancer. But again, they're usually toxic drugs. There's usually a downside, you get a plus, but you get a minus as well. So, it's not a place they've really gone to any extent yet. In integrative medicine, well, this is absolutely a number one place you're going to look. The thing that went wrong when you got cancer, what was it? Your immune system. So if you're going to go along and particularly if you're going to go along and do some treatments which are going to destroy your immune system utterly, chemotherapy, radiotherapy, if you don't look at your immune system, you're leaving yourself wide open to recurrence. So fantastically sophisticated methods, non-toxic as usual, all plus, all positive, all health-creating, and absolutely a number one basic thing you need to consider if you want to live a long time. These are just a summary of a few strengths of the integrative approach. So you've got a much broader view of the diagnosis. You're looking at everything to do with that person that got them to where they are. It's not just we're looking at your liver. A much broader range of treatment objectives and a much broader range of options as well. And yes, if you're going to have conventional therapy, then you can certainly make the whole thing much more likely to work, much less stressful and horrendous. And you're giving yourself, instead of walking out of the door on the last day of treatment, you've been given the all clear, and your strategy for staying that way is you've got your fingers crossed. Instead of that, by then you're an expert, like Fiona said, and you actually know exactly what you're going to do in order to do everything you can to stay well. So where's all this stuff happening? It's not happening in the UK, clearly. But these are a few places I've picked out here from around the globe that are doing integrative medicine. I've picked these particular ones because there are many clinics you can go and you can get what would be described as alternative treatments. These ones in particular will use chemotherapy if it's going to be helpful, but they'll use it in a very strategic way. They will use orthodox medicine, but only as part of a fully integrative program. So they're looking right across the board and they're treating you in a whole range of different ways at the same time. It's hard not to have more than one place in Germany, because Germany is really where it's at for this stuff, certainly in Europe. Mexico is where it's at on that side of the drink. But also within America itself, we've got the Block Center, is actually in Illinois, which is really, he's been doing integrative medicine for 30 years there, Keith Block. He's a bit of an integrative medicine hero. Yeah, but as I was saying, sadly not in backward Britain. Well, that's right. So, we're very positive about change. I can tell you a little bit about that in a minute. That's why we're all here, aren't we? We're making change, yeah. All right. So what's possible? So you're going to hear some fantastic things on Sunday about what's possible from people who've actually done this stuff. I'm just going to give you one quick example here. There's a lovely lady, Claire, here. She went for treatment in Germany at the Herzog Hospital, and she had stage 4 breast cancer. She had secondaries in her bones, all over her ribs, all the way down her spine, in her pelvis and in her liver, and she had trouble walking at the time that she went out there for treatment. Yeah, and by our standards, well, she was going to die quite soon. So she had 6 treatments over 6 months there, went for about a week at a time, and now all her markers are down. She's on what she would call a maintenance treatment at this point. So she's doing things just to help keep things under control, but she's incredibly well, incredibly fit, looks brilliant, getting on with her life meanwhile. So, extraordinary achievement that literally we can't do that in this country at any one place. If you want to build an integrative program in this country, say you're not in the league for going to a very expensive clinic in Germany, you have to do a bit of mix and match here. So you've got to do it yourself, and it's not that we don't have great practitioners. There's some excellent practitioners, not nearly enough, but we have got some. And it's a matter of finding who they are, what they're doing, and finding out what's right for you. Now, it is unbelievably complex. And over time, you will become an expert if you go into this stuff, but it does take time. And quite often, people haven't got time. So this is where an organisation such as Yes to Life, we work with Cancer Options all the time to try and shortcut this process. That's what we're doing. We're trying to get good information to people early on so they can make some good decisions about what to do, where to go, what kind of treatments to put together. So it can be done in this country, but you're going to have to shop around and you might have to travel quite a bit in order to get all the different parts of your program. But there's some brilliant people doing some great stuff. So ideally, you find a supportive oncologist. No, not that one. This one. Yeah. Yes, there are some, but unfortunately there are not very many. You may just have to do without a supportive oncologist. That's just simply how it is. And you may have to manage around them. It's entirely not the greatest thing because, of course, the great thing about an integrative clinic is that the team there, including your oncologist, knows everything that's happening to you, how they're all going to interact, why changing that thing might have made that change. They know exactly how to respond to the whole totality of your situation. If your oncologist is working with no idea what you're doing over there, that's a downside. There's no doubt about it. So, but it is essential that somebody is looking at the whole picture. It's really important. So you have to find somebody who's going to help you keep an eye on the whole picture. Otherwise, you're just trying to deal with separate bits of a program that might be reacting badly with each other. Let's look forward a little bit here. The momentum for change is growing. Okay, so this is something we had a little hand in last year, which I'm very pleased about. This is the first organisation in this country for any practitioner who is involved with helping cancer patients to join, to become part of a movement for integrative oncology in Britain. So it's the British Society for Integrative Oncology, bsio.org.uk, and all you practitioners out there, go and take a look and think about becoming a founder member. It's just launched in the last few weeks, and we're hoping this is going to become a real force for change in this country. So a little bit of history here. 1972, this was what the NHS was told, encouraged to be more responsive to the needs and choices of its users. That was pretty radical in 1972. And then we've had decades of talk about patient choice and patient-centred care. Anybody who's been near kind of NHS policies and things will have heard all these words bandied around. Absolutely no sign of anything happening, except for lots of people getting jobs with names that were to do with patient-centred care and choice and things. But anyway, suddenly, out of the woodwork, much to my surprise, April 2014, personal health budgets come into force. Now, what is that? Nobody's even heard it's happening. This, you know, what is the personal health budget? Now, we're very interested in personal health budgets. That's what I would say a personal health budget is. The most significant thing to happen in the NHS since it started. So some people, unfortunately not, you know, huge swathes of people, but some people who are in a very chronic situation will have a legal right to have a personal health budget. What is a personal health budget? Well, it's where the patient themselves propose, they get given a budget per annum to spend, and the patient themselves proposes what they're going to spend it on. For example, the kind of person who would easily get into this at the moment would be somebody who is sort of confined to a wheelchair, needed 24-hour care, and they could say, right, I want to employ this carer, not your one coming from the agencies, I don't like them and they come at the wrong times and they're always a different person. They employ the person they want to help them. They say, I want this piece of disability equipment, which is not supplied by the NHS. It comes from Japan. It's fantastic. And that's what I want to spend my money on. So they really will be able to say, actually, what will help them. So will they do it? Good question. Well, look, this is what I'm saying. It's just the beginnings, all right? There's no point in getting overexcited about this as though it's going to be overnight change, all right? But this little triangle that's been going on for ever since the NHS began is suddenly a little crack here, because it's like, instead of the three players, suddenly there's us, the people who are sick. We can say something about it. It's been mentioned once this morning. I'm going to mention it again because it's somewhere we need to put our attention, the Cancer Act. Okay, so this is kind of the most important bit out of the Cancer Act here. I'm just putting it up so you can see what it is. So just to give you an idea of what effect the power of the Cancer Act is that nobody knows it's there, and it's working behind the scenes all the time to keep control of what happens in cancer care. And to give you an example of what the ways this might affect, the kind of effects it might have, okay, is you're running a supplement company and you produce a supplement, and you know the University of Illinois does this trial, a very good trial, very properly done, and they show that this supplement is actually brilliant for people with prostate cancer. Yeah. Now, if you, on your website, selling your supplement, put a link to that trial, you've broken the Cancer Act. Now, what help is that to anyone with cancer? That's a good piece of information for people with cancer that's being withheld. That's just one example of the ways in which, a bit like the picture there's a big sticking plaster over the truth about what works, and it's being controlled enormously by this one rather strange act. Yeah, I wouldn't say necessarily that we don't need a Cancer Act. On the other hand, it's rather curious that we have a Cancer Act. We don't have a Heart Attack Act or knee pain act or anything else, just a Cancer Act. Why is that? Interesting. But nonetheless, the Cancer Act doesn't have to be something that stops good information getting out. The Cancer Act could say that if you don't have any good evidence for it, you can't advertise it. How about that? That would be all right, wouldn't it? Nobody would mind that. Fits what you're saying, but it doesn't stifle anything. So, anyway, something to think about. It's 1939, yes. They've changed it, adjusted it a little bit, but fundamentally it's still the same. It comes from a time when we didn't even have an internet. So that's why it's important. It's a very important thing, and it's important that we stop having it working below the surface. We bring it above the surface, make everybody aware of it, and say, well, do we like it? So, to sum up, there's two places that I think it's very important that our voices are heard in the coming years. This is one of them. Okay, now personal health budgets are coming in here. Now the forces that be, and by that I really mean business, won't like this. Okay, business likes the setup they've got at the moment. They're doing very nicely out of it. So they will, of course, put enormous efforts into trying to hold back change. The only thing that's going to make any headway against that is us. We have to actually say, yes, we like this choice you're giving us, and we want more of it. The evidence that they gain from running trials of personal health budgets said that the more money you give people and the more choice you give them, the better they work. Okay? So we need to get behind that, the evidence, and actually push for much more choice. And the Cancer Act, as I say, needs to come out of the closet and get a thorough going over. So that's my little message for everybody here. I hope you like to join me in pushing that agenda. And I'd like to say a big thank you to Fiona for inviting me today. It's a real pleasure to have been here to be able to speak. Fiona's done an amazing job on pulling this all together. Thank you very much.